Thank you, and welcome everybody to the committee hearing. Just to go over the agenda and some of the folks present today, we'll continue our oversight of DCFS, and we'll continue to talk about our punch list of the things we're working on and logistically to see if we're hitting our timelines. Just to let everybody know, as a committee, if you would like, I know some of the committee members did call me about this. Miss Emily Dixon and Julie Floyd are here from the auditor's office, and I also did see Mr. Wagerspack a little while ago. There is a kind of a performance audit that's been done, and some of the committee members wanted them here in case we wanted to discuss those things. Also, in your packet, we've been talking to civil service, and I know that's important for the vice chair. She's asked upon that. There's a civil service letter that basically says in our packet that they're working on certain pay grade adjustments and certain things they're looking at to make sure that they're in the marketplace. I'm sure the secretary can expand on the discussions they're having. So we wanted to know that's in the packet. And if you were calling upon civil service, they did have a conflict, but as a courtesy, they put that letter out there for us. And then the second phase, once we finish with DCFS, we're going to have a little discussion with the Board of Medical Examiners concerning some legislation that was passed and that we'd like to just kind of get some clarity on that. And Ms. Patricia Wilton with the LSBME is also here. So before we get started, I did get a request from Senator Boudreaux that he would like the floor before we do get started, and then we'll turn it over to the Secretary, and we'll begin our discussions the way we do it. Senator Boudreaux, the floor is all yours.
Thank you, Mr. Chairman and members. I asked just for a couple of minutes to apologize. I know the first two meetings, the first one I was actually in Rome and got a chance to visit with the Pope and the other Pope, and missed the meeting.
You always get to visit with the Pope. He's right there.
And then for our second meeting, I was in Chicago with 4 nuns in a 3-day formation session. So thank you for your prayers. We had a safe journey. I did get a chance to look at the meetings upon my return. And I just wanted to chime in and acknowledge, first of all, that we do have some issues. I know that we are working tirelessly to address those. I always like to look at the glass as being half full and not half empty. And we can get stuck in talking about what we could have, should have, would have done. We've had some tragedies. And I guess just in a couple minutes, I just first of all want to start off by just acknowledging the service of our former Secretary, Marquita Walters, for her years of service. This industry has changed so much. She's endured and inherited a lot. And I was not present during that time when her decision was made, but I just want to acknowledge that we don't have a lot of people who are jumping in line to take on not only civil service jobs, but secretary positions in the government sector. They go into the private sector and they're shielded away from so many of these things that we're dealing with. So I wanted to do that. I also want to just to our current secretary and to the staff. You're not alone. You're not alone. While I said earlier, we have to acknowledge that we have to make some changes. We have to collaborate with law enforcement. We have to do some things that in the old days, I guess, it wasn't as prevalent. But today, we're in a situation where we need to identify some solutions. I know we'll talk about staffing issues, and the chairman just alluded to civil service and some of those regs that we have to do. But at the end of the day, we have to be positive in this approach. We have to. I read the articles this week on surveys. None of that is new to me. I heard it a year ago. I heard it 2 years ago. I heard it in 2016 when Governor Edwards came on and saw the cuts that devastated this agency. So none of that was new. If we went into each and every one of our agencies in the state, our employees would say the same thing. We're underpaid, overworked, we can't get it done. So I don't want to dwell on the negatives and what they're putting out. I want us to look at solutions. I want to look at partnerships. I want to look at best practices and how we do more with less, because that's where we are. And I mentioned law enforcement earlier, and I know they're shorthanded and they do some things. And I know one of the main issues that has popped up is, the workload of our individuals. And somehow, Madam Secretary, if we can identify those partnerships and get law enforcement to assist us in some manners, I think the state is going to respond to that. And I'll close for this portion just by saying again, I know I've met with Secretary Phillips, and I know there are some other agencies that have to collaborate with you all, and I'm going to ask them to continue to do that. This is not just about DCFS or children and CW. It's about the state, and it's going to take all of us working together to get there. And I'm going to ask all those other agencies who are on board and who are working to continue in this vein. It's the spotlight is, of course, where we are today, but that doesn't take away the need for us as a state to work together. So those are my comments. And again, as I said, apologize. What happens when you miss 2 meetings? I used to sit next to the chairman, and I'm at the end next to our lawyer. So I'm kind of like in timeout. So I'm okay, but I got the Pope right next to me, so we're good. Thank you, Mr. Chairman.
I think you're in better shape than Senator McMath right there in that company.
Thank you, Mr. Chairman.
Y'all, on a very somber note, I'm going to turn the floor over to our Vice Chair. Vice Chair.
Thank you, Mr. Chairman. I would like to ask you guys to join me in a moment of prayer for the 3 band players with Southern University who was just in a tragic accident. 3 members of the Human Jukebox have died in a 18-wheeler crash. And so I'd just like to take a moment of silence for those 3 babies and their families. Thank you, Mr. Chairman.
Thank you very much. I guess turn it over now to our work. Before we get started, do you have the workflow chart that we were going to have?
Yes, I think
can
the
we get
staff
that?
has some things to.
Can we get that to the members while we starting opening comments?
Yes, sir.
And I guess I'll just get it started. Madam Secretary, welcome. Thank you for taking this position. And last time we were in a meeting, there was a full table with your colleagues, and I know things have changed. And I know Senator Boudreaux did a good job of talking about it. So I'll turn it over to you for opening comments. And members, unless you see differently, we'll continue to go through the workflows, and we'll talk about the deliverables. And we'll do like we always do. We'll have just a wide open discussion, and it'll be just a working meeting like we've done before. And I will tell you, since we've been doing this every 6 weeks, I find that I'm getting calls from the public that they're very appreciative that the department and the Oversight Committee and Senate Health and Welfare is working together to go through these issues. So, Madam Secretary, I'll turn it over to you, and then if the committee members have any questions or concerns, we'll bring that out. If the board is clear, then we'll start going through our workflow.
Yes, sir. Thank you
Thank
so
you.
much. And good morning to each of you. I am Terry Ricks. I'm the Acting Secretary for Louisiana Department of Children and Family Services since November 11th. I have had the opportunity to view, since that time, the entire department anew, from the macro level, the meso level, and in child welfare from in the micro level. What I have found so far, underscored by recent research, is that those who have decided to work at the Department of Children and Family Services are courageous and dedicated. And everyone wants to do a great job and work in a supportive environment. As we begin this hearing, I felt like it was important to highlight some of the great work of the department this year. Wanted to bring your attention again to the cooperative endeavor agreement that we signed at the beginning of the year and that we have implemented with the Louisiana Association of United Ways to strengthen the social services infrastructure. Louisiana 211 has long answered the call for shelter, disaster assistance, housing, health care, and more. Since this partnership launched in January, more than 115,000 residents have been helped to meet 130,000 basic needs. To meet these needs, Louisiana 211, we're providing referrals to more than 223,000 referrals. This CEA has brought us the capacity to do closed-loop referrals for clients using the Unite Us platform, and today more than 800 of the DCFS staff are using this tool to provide resources to clients. The latest of our divisions to start using that was Child Support Enforcement, which launched on yesterday. So we're very excited about that work, and we believe it leads to a closing of the holes in the social services safety net. We join our partners with the Department of Correction. The division of our Workforce Division is also using it, as well as some in child welfare, which will be growing as we go. On the closed-loop referral platform are 1,399 other agencies and social services providers and health services providers. This is combined with what Louisiana 211 brings to us, connecting over 8,000 different services, either through 211 or on the closed-loop referral platform. We find great breeze of hope flowing from that work. Also in January, for those of us who have sort of missed the news, and I feel like, Mr. Chair, we find ourselves needing to provide you more clear information more often, because I understand that some of the members may not have realized that in January, we doubled the federal cash benefit for those on FITAP. It went from $240 per month to $484 per month, moving Louisiana from 50th to 28th in the nation, bringing us to the national average for the cash assistance. Since January, the number of households receiving FITAP has increased 78%, and the number of workforce participants tied to the program increased from 880 in January to 2,120 in November. We developed the SNAP Employment and Training Program even further, and we created a child support employment and training program that doesn't just impact the custodial parents, but the non-custodial parents, and it's the first in the nation to do both. Our Assistant Secretary, Shavonna Howard, is here in case you want to talk about any of those things and many of the other good work that has been done. She was one of the persons featured in the President's conference on food insecurity earlier this year. Also, DCFS child welfare staff working in partnership with all our partners, the courts, CASA, Wendy's Wonderful Kids, the First Lady's Louisiana Fosters Initiative, Foster and Adoptive Families, and the children themselves who are desiring permanency. We successfully brought 700 children through adoption in the last federal fiscal year. That includes 3 adults, young adults, in the extended foster program who actually found permanency as young adults. That goes to the work, our good work all together with extending foster care. It is never too late for our children and youth to find permanent connections, and these are great highlights. So these few highlights are among the many that I wanted to shed light on that is happening at DCFS. We're still serving 1 in every 4 to 5 people in the state, and we're happy to do so. As for our matter at hand, the reason we're having this meeting, we are grappling with an increase in child abuse and neglect referrals, resulting in high caseloads, frequent turnover of staff, which negatively impacts our ability to respond to the demand, and an unfortunate increase in child deaths among the families with agency involvement. We are working with experts and partners. We created the 7 strategies, which we have gone over with you before and we'll get to a little bit later. Given the time we have been working in them, given what we have assessed as the need, what needs immediate attention, we have updated them, and we'll bring you up to speed on that. You might recall that the 7 strategies to stabilize and rebuild Louisiana's child welfare system, what we call the 7 strategies, was drafted in August. It is basically based on a publication by Dr. David Sanders of Casey Family Programs. The name of it is, If I Knew Then What I Know Now, 7 Strategies to Reduce Child Abuse and Neglect. Child abuse and neglect fatalities, sorry. We have been laser focused on both the short-term actions that will help stabilize the child welfare division and the longer-term efforts needed to improve our child welfare system, and of course that system advances outside of us so that we can better keep children safe and families supported. Some of this work goes way beyond the 7 strategies that we'll be talking about, but with the help of our resources like Casey Family Programs and the dedicated staff from across the state, our reviews have identified opportunities for us to update our structure, processes, and systems anew. I take a lot of encouragement for this work, as I have seen our team pulling together to get us where we need to be. Though the implementation phase of the 7 strategies is really just beginning, the first phase, you remember, was planning. 40% of the defined tasks have been accomplished. 30% of them are in progress, and another 30% have not yet come due. Many of the in-progress tasks are ongoing, are recurrent, on a set schedule. So from the perspective of effort required, we're closer to 65% in those areas. In other words, we're over the hump of the initial startup and should begin to see the results of the intensive efforts put forth over the past few months to stabilize the system. We'll go over these shortly. I'm not naive. Like me, I hope we can all acknowledge that as we continue to recover from the pandemic, from the hurricanes, and in light of the financial instability of so many in our state, our communities and our department are rebuilding. And it's an ongoing process that takes time and deliberate action and the partnership that has been acknowledged today. Today, we'll report to you on both the changes made to the timelines and the short-term actions that are in process. We are right now focused on a set of immediate short-term actions that are aimed at ensuring 4 things. We're making timely assessment of safety to every child we are charged to investigate through our centralized intake process. We're tracking our efforts so we can make meaningfully informed decisions. We're identifying and engaging our partners who can support us in the effort, and we're augmenting, deploying, and supporting staff to better help the children and families we serve. These are our 4 pillars. We're gonna keep working in them. That's where we've been working, and we're gonna give significant attention to them between now and March, because we know that if we're able to do these things, then we're able to move to a place where we can work with the community and our government partners to further stabilize the entire continuum of care and support for families. We have faced and are facing mighty challenges. I commit that DCFS is going to do whatever we need to do to get where we need to be. As I said before, it's going to take all of us. And we need the community just as much as our communities need us. This is the time for us to reset all of us. Like Senator Boudreaux said, let's all address the despair that leads people to choosing drugs, for example. Let's all educate how risky activity leads to harm in children. Let's together take care of our neighbors. This is something bigger than CW can alone, the Child Welfare Agency alone can solve. So one of our major pillars is to rebuild and expand our partnerships that lead to having stronger, healthy communities with strong, healthy families. As we focus on caring for the children and families we are charged to serve, a focus on child safety leads me to staffing and talent development at DCFS. It is because child safety is job number 1 that I focus on talent retention and recruitment, as well as staff and culture development for the department, with a focus on strong teams. I'm convinced that all our staff want to do is take care of children, and they need the resources and tools to do that job well. That's my job. I know that secondary trauma is real for those who are in this work, and I know that the work is hard. I know that the work is necessary, and it must be done with a high degree of care, support, and accountability. Our focus on the retention of staff, retention activities includes important work. Sometimes it's hard to count, but it might count the most. Our office climate and culture work includes creating psychologically safe spaces for workers, children, partners, families with clear expectations, support, and accountability. That means that we are bringing up a culture of belonging. We've got a new set of language. It's been approved by our council. The staff council is leading us in this, approving our new curriculum. It's a culture of belonging. We're using Brené Brown's work. And with that, comes coaching. We have a new employee assistance program. Right now, it's for child welfare in 3 regions, moving across child welfare across the state, and we want it for all programs because it's not just the child welfare workers who are buckling under the pressure of the caseloads. We have told you about our diversity, equity, inclusion, and belonging unit and the staff council, which is providing more lines of communication for staff and through which we're also rolling out the belonging training and coaching. We have made leadership structure changes. You have met Ms. Evelyn Jenkins at the last hearing, who is serving now as the child welfare director. We are using needs assessments, and we are planning efforts to make sure that we can create very good outcomes. We have added a new regional administrator over the Baton Rouge Tri-Region. Dr. Matthews was installed 8 days ago, 8 calendar days ago. She is getting her sea legs right now. We added and filled an assistant area director position. The area director is the position that's over each region. Adding an assistant area director position allows us, the area director, to focus on practice while the assistant area director focuses on administrative and operations within the office. Also, we added in Baton Rouge a position and filled it is the regional CPS consultant position who's in charge with assigning cases. This is real new work where we have identified a gap that was impeding our good service delivery. So this has been added. This position will be added to each region. We are focused on proper payment as we're working with civil service for that. We're focusing on ensuring fair and equitable opportunities for all employees and have specific plans for that. We are focusing on allowing life balance for our employees. I'll explain that a little bit. And our recruiting activities are also important toward retention to balance out the workload and create a life with balance and greater health for our employees. Ultimately, it's about care and respect. It's about valuing the people who are in this department and becoming an employer of choice. That is my goal, where people are coming in knowing they're walking into a space where they're valued, respected, and supported. It's about living out our values. In recruiting, we've had 8 successful recruiting events around the state. They have yielded 307 conditional offers throughout the state. 140 of them are in child welfare. We have leaned out the process that it takes for hiring and recruiting. We're reducing that time from 2 to 4 months to 3 to 4 weeks once we have identified a candidate. We have had incredible partnerships with the Louisiana Workforce Commission, the Division of Administration, Civil Service, OTS, the Governor's Office. Leadership is the lock, so we've made some changes. And the doors are opening, and people are showing their courage to become a part of the dedicated professionals that are at DCFS. So we spend that time hiring the people, but right now we still have deficits. So we're bridging. We have provided you some information on the way that we have bridged using augmented staff from around. First, we did strike teams. Then we brought shorter-term teams from around the nation. Around the nation. I wish we had them from around the nation, from around the state. We have added nurses to do assessments and creating safety plans for substance-exposed newborns. That takes some of the work off of the staff. It also allows for the work to be better. Beginning next week, we will bring in a critical incident support team. This is actually bringing in DCFS workers from around DCFS. We haven't made this announcement to the staff yet. On Friday, we meet with the statewide leadership. But as an executive staff, we have made a decision, and Ricky Monte, our emergency preparedness director, is leading this effort with me. We are creating a space for now and evermore, where on the human services side of ESF 6, and we always talk about mass care and housing, Human services is everything else, and the social safety net is a part of that. By going through this critical incident support team, we are going to be pulling DCFS workers outside of child welfare who may already have some child welfare experience. They will be added onto a team and moved into working child welfare for about 3 months. At the end of March, we believe that those 300 people that have those job offers in hand will be in the seats. We know that there will be approximately 8% fallout for those persons who have decided they don't want to come. There might be even another 15% fallout if we're looking at the data from the previous ones, from those that we reject based on them not fulfilling the conditions of our offer. But if we're talking about 27, only moving 23% of them to another category of not joining us, we're talking more than 250 people joining us into the department by March. So this critical incident support team made up of committed people that don't need to learn what DCFS does. They don't need to learn our systems. They're coming in ready to work. This is going to be a part of our long-term strategy that if we need it, if we have a hole someplace else, we'll be able to pull up this critical incident strike team and not worry about the rest of child welfare falling at risk. We're working with the assistant secretary and the undersecretary, as well as legal, to make sure that we do this well. We have the support of civil service and the division for this work that we're doing. The number of partnerships that we are strengthening is a little mind-blowing. I'm a little bit concerned that I'm going to forget to say somebody's name, and so I'm not. But the law enforcement partnerships that Senator Boudreaux underscored are underway. Our 2 of our deputy assistant secretaries have been going throughout the state meeting with law enforcement partners. Last week was the opening of the Family Justice Center in Baton Rouge. Is one example of ways that we can work together. They will be co-housed with law enforcement in Baton Rouge at the Family Justice Center so we can do better work together. We have another meeting with Baton Rouge tomorrow, the Baton Rouge Police Department. Perhaps we will move to seeing if we can get a contract with them to get some of their locally trained, especially those who are working in communities already, to contract with us to do well checks. So as I almost move to a close here, I want to say that all these efforts are about getting our eyes on every child in a timely manner. We want to ensure timely assessment of safety. That is the thing that weighed on me the most as I stepped into this position. How are we going to ensure that we're making timely assessments of the children referred to us from centralized intake? Toward that end, we have established new processes for ensuring that by the end of the day, we know the answer. Who has been seen, who has not been seen, and what are we going to do about it? So the staff augmentation, the retention, the recruitment is all helping us with what are we going to do about it. But we're also making procedural changes. For example, you've heard us speak before about CCDM, the case consult and decision-making model, which allows us to mimic a process that Idaho has used to reduce backlogs and allow for cases to be closed more efficiently when they need to be. That means that we have a cadre of supervisors available as soon as a worker needs one to provide the information. The feedback that we've gotten from staff is that the CCDM is actually freeing for them because they're really being able to use their case practice and immediately make decisions. We're going to track our efforts, sir. Our second pillar of tracking our efforts to make meaningful, informed decisions, it was data that led us to using nurses, but our systems are antiquated and they're not yet bringing us the type of data that we need. Right now we have point-in-time data. We don't have roll-up, we don't have emerging trends and forecasting, but we do have partnerships. We have a partnership with the Blanco Policy Center at ULL that's helping us with that, and we're working with OTS and Deloitte to provide some immediate changes to our systems that will give us more important, better processes and better data. As we identify and engage our partners to support our efforts, we already talked about law enforcement, but I want to talk about the Secretary of the Louisiana Department of Health, who has brought her entire team, Medicaid, behavioral health, and Office of Public Health, and everybody else, to help us identify where we can shore up the processes to use our Medicaid services, understand behavioral health, and get all we can from the MCO contracts that we have. We've had incredible meetings, and they continue. The partnership is strengthened like it has never been before. And we have other efforts like My Community Cares, neighborhood-based prevention work that will continue and is expanding through the family resource centers throughout the state. So, as I close, I want to say this. Everybody in this state can get involved in this work, and we need you to. Whether it's a person in your family or a person in your faith community, if you see someone in need of help, you might be able to help them yourself. If you think they need resources, let's pick up the phone and call 211 and see if we can find resources. Sometimes, a lot of the calls that we get, 50% of the calls we get, are about really families needing resources, not abuse and neglect. So we need to do a better job of helping people understand when to call for abuse and neglect and where to call for more resources. So we're doing that. We want everybody to remember that they can call 211. And here's another part of 211. We have a very specific part of the contract with 211. It's actually outside of the CEA. It is a contract for kinship care. We have resources on our website where if you are working with a friend or a family member and you see that they just need somebody to take their child for a while they go to rehab or they go handle something else, most of the time we just need to know, what do I do in that case? So we have a kinship navigator, several different prongs of that. On our website, you can find an incredible book. What legal document do you need to be the caretaker for this child for a while? It's in there. What resources might I need? It's in there. If you call 211 and say, hey, I'm interested in kinship, they have procured a very clear number of resources specifically helping for kinship to step in and help. So let's remember 211. Let's remember that we have the Kinship Navigator program. These short-term things that we're all doing, that we're doing in the department, and that if everybody picks up and sees how I might be able to help a neighbor, maybe we're going to be able to get to where we need to get to. We're looking at a long-term vision of human-centered, data-driven agency actions that take a holistic approach to families. We want to protect the children, support the families, and truthfully, we want to be a part of eradicating poverty in this state. Sir, I know that was long, and I thank you for your patience. I'm happy to have me and the team answer any questions you may have.
Thank you, and thank you for jumping in, because the minute you took this position, you've really done a fabulous job of getting things together. I guess just to kind of set the table, we do have a question from the pro tem, and I'm going to turn it over to her, but just kind of to go through it for the committee's thought process is, I think the task of what we're trying to do is go through these deliverables.
That's right, and for that, I'm going to ask Amanda Brunson to
let's
come
do
up.
this, though. Let's do this so we can knock a few things out. Let's get the legislative auditors up here.
Okay.
And if there's any questions from the survey, we can knock that out.
Okay, great.
And then the second thing I'd like to do is as some of the things you talked about as maybe goals, things you're working on, if that can be expanded on this,
Yep.
there's a lot of information we just got. So I'd ask the team at DCFS, as you're working on goals, let's make this a working document that continues to evolve. So on that note, if the legislative auditor team would come up, we'll do have a question from the pro tem and the vice chairman, and then we'll start working the
Thank you, Mr. Chairman. And I apologize. I'm going to share this with this room. I'm leaving, but I'm going to have this on my phone so I can hear it. I have a Pearl Harbor sailor who's being buried in my district today. So it's a huge thing, and so I wouldn't be leaving for a garden club. Just wanted you to know.
Not that there's anything wrong with the garden
Not that there's
club,
anything
okay.
wrong with the garden, but I just want to tell you, this is wonderful. And when you said that there was I think the term you used, you covered an amazing amount of ground. And I'm going to be really quick, and if I may have to leave before you finish talking, but when you said there was a gap in the Baton Rouge process, thank you for acknowledging. That's what we all felt was happening. Totally unintentional. And none of this is any reflection on how hard you all work. I just feel like we need to keep repeating that, because I know we got into some sensitive areas, but to acknowledge what that gap caused was a huge step forward in my thinking. So thank you for that. But and I want to get with you at another time to discuss that, but I want you to explain for me. I think it's really important that when you say on the website they can go to a kinship navigator, I'm going to remind you, we don't have broadband. People don't go to the website in the areas most in need of child protection. So tell me, what would be the difference? Most people call what the hotline is. I don't know the number of the hotline. I'd have to look it up. Has the 211 taken over so there's no hotline anymore?
No,
211 is the only line.
No, ma'am. No, ma'am. Let me explain this to you, but let me say this to you. 211 can lead you to the hotline. So if you
Depending
ever
on-
forget the name or the number to calling in child protection, if you call 211, which by the way is 24/7, 365, they can give you the number or connect you to being able to make a report of child abuse and neglect.
Do you have some snappy thing like this with 211 on it?
We do have some
Could you-
211
'cause,
data.
I mean, if I put it on Facebook, they will see it on their
Yes,
phone.
absolutely.
But, and maybe repetition will, because I don't think most people are aware of a 211.
I think you are right. And so this has been my goal, and this why we also invested in the infrastructure of 211 so that we can more broadly say, call 211.
Right.
So you are right. It is also true that there may be some other resource that you've heard before that has some not so snazzy 800 number.
Right.
And if it's a social service or health service resource, 211 will have the information. So if you don't remember anything else, call 211. They might be able to help you find resources. For those of us who don't have broadband, this is why it's important that we're actually using a telephone number.
Right. Easy.
But for those who do have broadband and want to look it up themselves, they can find the resources in printable formats for the Kinship Navigator. But if there's someone who's not savvy at all, whether it's with reading or whether they don't have broadband, if they pick up the phone and call 211 and say, I need to take care of my granddaughter, I need
Right.
to know how to do that, those who pick up the phone know how to get them into the kinship resources for that. They will stay on the phone and make sure that they understand what they have available to them. And then also, we have someone dedicated in the department for kinship services, and they will also be able to provide that connection.
And I've got to leave, but the other thing I want us to discuss later, when you refer to a timely assessment and the tracking efforts, I want some specifics on that. If I don't mean by the minute, but just some general idea. Is that across the state that the expectation on what is a timely assessment is going to be normalized and the tracking efforts are going to be consistent across the state?
Yes,
Yeah.
and they're new. But
Okay.
I also want to say that the expectation for a timely assessment is not new.
Right.
But understanding that we were missing the mark on some of that, and we may not have known what was the cause or where was the effect. immediately. So the efforts that we have taken have been led by the Deputy Assistant Secretary who's over the field. There is new processes on actually understanding where that is and knowing what has happened so far across the state. But I have to tell you, we had a call yesterday that helped me understand where the gaps are in the process, right? So we have to lean it out until we can get something that sounds good, looks good, but is actually working. And it's that part that we have to get down to the ground and work with leadership on the ground to see what was not necessarily working. What it has yielded is some very good conversations where we've been able to see maybe there's a worker who is either not understanding or they're not timely inputting the data. And so this is one part where we've worked with OTS. I actually contacted Dickie Howes on a closed Friday, and he immediately contacted me back, and resources were on the ground the next business day to find low-hanging fruit to help make it a little bit easier for the staff on the ground to put the data that they have in the system. That is a gap, and we are working on that. If I can take that job from being 20 minutes to 2 minutes, that's going to yield a lot of time for the staff, and it'll make them less frustrated with the things that they have to do ancillary to the job.
Well, I thank you. I've got to leave, but
Thank
thank
you.
you,
Thank you,
and
ma'am.
I'll be listening. And thank you.
If that's not on the list, let's put it. That's a good goal. It's a good goal. Be safe, Madam Pro Tem. Vice Chair, it's all yours.
I was actually waiting for the auditor
Okay.
to come to the table.
So why don't we bring the auditors to table? And why
Protocol.
why don't we go through the highlights of the Child Welfare Job Satisfaction Survey? And please, stay there if you like.
Yeah, that's great.
And we'll just have a discussion, and committee members and everybody, the panel, this is a working meeting, so it's a good discussion.
Very good.
So I received a call from some of the committee members saying they'd just like to maybe talk at that 50,000-foot level of your findings, and then we can kind of have a discussion. And Madam Secretary, if you want to jump in, jump in.
Great.
So it's all yours. Thank you.
Thank you, Chair. Good morning. My name is Emily Dixon. I'm manager with Performance Audit Services with the Louisiana Legislative Auditor. We were asked a couple meetings ago by the committee to conduct a survey of child welfare employees on their job satisfaction, and also to report on the initiatives that DCFS is currently making and has planned to address morale and job satisfaction. So with DCFS FAST, that's a tongue twister. I don't know how you say that all the time. Fast Help, they helped us get the email addresses. They reviewed our questions to make sure that we were asking questions that were going to be understandable to all child welfare staff. And we sent over 1,400 emails out, asking for survey responses. Now, these employees at DCFS within child welfare work for centralized intake, adoption, child protective services, foster care, extended foster care, home development. And they also went to the leadership at the home office who oversee these people in these child welfare areas. So our goal was to assess their job satisfaction, identify any barriers that they felt that were preventing them from either doing their job or doing their job as well as they wanted to, and also assess their feelings on leadership and accountability within child welfare leadership. So we got over 800 responses, which to a quick survey like that to us is a good response rate, especially being that they've been conducting many surveys, so, and their time is limited, so for them to fill out a survey for us, we know takes a lot of time. So obviously it's no surprise concerns were noted related to job satisfaction, morale, barriers to conducting their work, and then some concerns with leadership and accountability. And again, nothing, like Ms. Rick said, nothing in this results were a surprise to us, to DCFS, to the committee. DCFS has been saying since the get-go that they were aware of these issues and have, I think, based on their initiatives, it proves that they were already, making strides to address these. These were also similar issues that were noted in our 2014 performance audit on child welfare, where we conducted a survey of child welfare caseworkers only. And as Senator Boudreaux said, also issues noted in the 2016 Governor's Transition Report. So we're right now going through the text survey responses. We agreed to give those responses to DCFS at the beginning because, I mean, they're the ones most valuable to them. But we're going through those to redact any kind of identifiable information so that we can ensure that the respondents remain anonymous. So where they work, if they mention in their responses where they work, what area or what region, mention any names, we're taking all that out. But I feel like these text responses will be of most valuable to them. Kind of drills down to some details. There's a lot of specific complaints and concerns, but there's also some really good suggestions throughout those that we felt that, you know, management would know whether or not those were practical or would work. But I feel like having that information in addition to the meetings that they're doing with staff on the ground hopefully will add some value too. So Julie's going to go over the findings at a real high level. Go ahead.
Hello, my name is Julie Floyd. I'm a senior performance auditor with the Legislative Auditor's Office. So we asked child welfare employees what's the most important issue that needs to be addressed at DCFS, and respondents repeatedly mentioned pay, high caseloads and unrealistic expectations, and a lack of support and respect from supervisors and managers. Results from the survey show that more than 88% of respondents are passionate about the work that they do, but only about 54% are satisfied with their job. Now, this is an increase from a survey we conducted in 2013, which found that about 34% of child welfare caseworkers were satisfied with their job. So that's a change from 34% satisfied in 2013 to 54% satisfied in 2022. From the current survey, most respondents are not satisfied with their total compensation. They're generally more satisfied with the way they are treated by their immediate supervisor as opposed to managers and supervisors in general and child welfare leadership. And when we asked what could be done to improve job satisfaction, they repeatedly mentioned improving pay, increasing staffing levels to decrease caseloads, improving staff support and respect, and improving supervisors' skills and training. Results from the survey show that more than 57% agree that DCFS fosters and encourages an agency culture that promotes the welfare of children. However, only 28% agree that their caseload allows them sufficient time to provide quality services, and only 37% agree that they have access to adequate resources to provide quality services. Other barriers mentioned include a lack of support from supervisors and managers, concerns about transportation, and many caseworkers don't feel safe while conducting their job duties. Just over half of respondents agree that the individuals in child welfare leadership positions model qualities such as accountability, respect, and empathy. Examples of concerns also included not hiring employees with the necessary experience and skills, promotions that are not based on achievement and performance, the feeling that employees are not held accountable when they behave inappropriately, and the belief that if employees bring up issues, they will not be addressed. When we asked what changes could be made to improve leadership within DCFS, respondents often mentioned training for individuals in leadership positions, improving accountability, and promoting individuals based on qualifications. And there was also a consistent message that employees wanted to feel heard. As the committee has heard during this and previous meetings, DCFS has proposed a range of initiatives to address these issues. In the appendix of the report, it has the responses and results from all the questions. There are a few spots in the report where we broke down the responses by region and work area. And finally, I also want to say thank you to DCFS, as always, for their cooperation and assistance, especially during a difficult time of transition. This concludes our presentation. We're happy to answer any questions.
Thank you. Thank you, Mr. Chairman, and I certainly do appreciate you guys for doing this audit, allowing us to see this information. Again, like my colleague said, most of this information was not new, but there were a couple of things that did catch my attention. So I want to first ask, how were the surveys administered? Were they through emails? I heard you. Did you say text?
We sent emails through a SurveyMonkey, which is the platform that we use to conduct our surveys.
Okay.
It allows them to remain anonymous, and then it helps us do our little data crunching numbers afterwards. So that's how they got the email, the survey.
So I guess there must have been places where they could actually elaborate on specific issues or
Yes, ma'am.
topics or.
Yes, we asked a number of our questions were the agree, disagree, strongly agree, that form. But then at the end of each section, we asked a question open-ended, like, are there any concerns, or what are your specific concerns, or would you like to expound on any of the questions that we've asked? So there were probably about maybe 6 or 7 fields where they had a chance to kind of open and discuss either questions in that section or just on their own.
One of the things that caught my attention was transportation still being an issue. I thought with purchasing the new fleet of vehicles, we would have addressed a lot of those problems, but evidently not, or...
Senator Bear, I'd love to take that. So when we addressed the fleet is that we swapped out the old cars for new cars. We didn't increase the fleet. So if it were, if I had my druthers, as my mom used to say, every child protection worker would have a car assigned to them so that they could leave and go whenever they need to all the time. But that's not the way it is. There's a gaggle of them that people can go pick up one if they're available. If they're not, then they actually have to go and get like an enterprise vehicle.
You have to rent a vehicle.
Or they use their POV, their personally owned vehicle, and then, there are reimbursements for that, which can also take some time. So that's what the previous secretary talked a lot about. We swapped out the old ones for new ones, and that's been great. If you can get one, you're going to like the quality of it today. But there still are not 1-to-1 ratio for the people that'll be working today to go out today. And of course, that means, we've try to be creative, that, if today all you're doing is going to the courthouse, or you're going to go around close by, maybe you can use your personally owned vehicle. We have to talk about the fact that a lot of people don't have personally owned vehicles to come to work. So it definitely does take some of the staff time to find the vehicle.
That is something I would like to see us kind of delve into a little bit more, because, taking somebody's personal car, that's liability issues. Even though it's maybe going around the corner, there's still are some concerns with that. And then having to rent a car, I wonder how much that really costs us in a year. I have no idea, but I just I know that we had bought a fleet of cars and just missed the part that we didn't, I guess, have enough still to really address the issues.
Yes.
That was one thing that caught my attention. Then the other thing that really got my attention was, I think on page 3 of the report, number 4, where half of the respondents agree that, individuals in child welfare leadership positions model qualities such as accountability, respect, support, and empathy, but they talked about the lack of empathy, and that to me seemed like could be an easy fix. And I guess I'm trying to understand, for people who are managers, supervisors, that I'm assuming have moved up the ranks, who have actually worked in this arena, should be able to actually exhibit that. I guess that was just kind of
Yes, ma'am.
puzzling to me, and I guess I'd like to have, were there specific examples that they use or highlighted, or they just kind of just said lack of empathy?
There were some examples. Julie, jump in if you can think of any. Going to their supervisors with complaints, or something happened out in the field and the supervisor saying something like, well, that's just the nature of your job, or I tended to get the sense that it was just kind of a sense of, everybody's stressed, and, instead of taking the time to listen to somebody, it was more like, hey, you just have to move on and get your job done. I think they're just in such a state of crisis. I mean, the nature of their job is getting out there and, taking the times and some of the initiatives that they've talked about, actually listening to the employees and understanding this toll that they take on them, that this work takes on them on a daily basis. Maybe just stopping and slowing down when they can. I don't know when that's possible, and take a breath and.
And most of everything you're pulling from is from the written responses. I can tell you from my personal experience in speaking with staff and what that looks like and feels like to people is definitely tied to the amount of work there is. And I would say that I would think that the hardest job in this agency is being a supervisor. A supervisor is responsible for almost everything to do with the people below them, and that means all the administrative stuff, how they're feeling, what they're doing, and of course getting the work done. So when we're making changes, from on high, but they're the caseworkers in the front are the ones working with the people, and the stress that comes from knocking on a door, walking in a door and letting that door close behind you, not knowing what you're going to be dealing with that day, right? Mm-hmm. And so there is a lot of stress, and that's why we were talking about the secondary trauma. So I think what happens is a lot, what we see in other places is that the stresses from the new work or the work requirements, like we're saying, like what's going to happen, we've been talking about it all day, and what's actually going on the ground, it gets to management on the ground and the supervisors, and now they're having to deal with what's actually happening on the ground and what the expectations are from on high. And if we can't get the caseloads balanced where they are actually doable, then you're going to keep having that strife and that stress between get it done, I need you to get it done, I need you to get it done, versus I had 3 people on executive leadership call out today for one reason. Somebody's having a baby, somebody's, at a medical appointment, and somebody had a death. That happens on the front lines. What do you think the supervisor is going to be saying to everybody is left? We got to get it done, we got to get it done. And there's not, and so what we are proposing with the training and things that we're doing, one, stabilize the caseloads, bring more people in to take care of the caseloads. And I didn't even talk about the 24/7 contract that's coming. I think I missed that in my group, to be able to let people leave at the end of the day, because the stress is real. Bringing in the EAP, the Employee Assistance Program, where somebody can call, they don't need permission necessarily, they need to say, I have an appointment with the EAP, like I got to get out of here, I got to deal with this. They don't have to wonder if the supervisor is going to say it's okay or it's not okay. We have a resource. That supervisor may not be that resource. And remember that 20 years ago when we were here before, the supervisor probably didn't become a supervisor without like 8 years experience. Today, supervisors have minimum qualifications because so many people have left, retired since that time, and with the cut of the 500, you just have less people to be supervisors. So the supervisors are younger, some of them are younger, they're less experienced. So they're trying to learn all the new stuff about all the new drugs, about all the new dangers, all the new risks, and they're trying to take care of the employees. And the employees are just as stressed out because they're also recovering from COVID, from losses, from the hurricanes. And so it's a very stressful environment. We need new tools. We can't keep doing what we're doing. So that's why that's why the EAP, that's why the culture of belonging training, that's why the coaching for staff and the new accountability tools are not for gotcha. The accountability tools are to say, hey, what's happening? Help me understand what's going on. Why aren't you able to do this well? Let's figure it out. But it's not just going to the supervisor, it's going all the way up so we can take a look at what are the trends, what's going on here. And it might be a hard area, right? And so one of the things I've heard is that I'm not so sure that the cases are being distributed fairly. Now, fairly is a hard defined term. Yeah. However, with a dedicated resource that does case assigning now. We believe that we'll be able to get that under control too. So before getting into this job, I was working on all enterprise-wide activities and initiatives. In that space, it allowed there to be an open door where people could come talk to me. I wasn't in their line of supervision. I might have been more safe to speak with. So all the initiatives that we are underscoring and adding on have to do with my personal contacts with employees who have told me where their struggles have been. And so I agree. I can't wait to see what you guys send us back and what people put in that survey, but I have the rest of them to pull from too, and my own conversations and visits with the office to pull from.
So along those lines, going to page 11, where it actually highlights several regions, Lafayette, Lake Charles, and Monroe, where they believe that their caseload, that they have sufficient time and adequate resources. What is that attributed to? Is it because they don't have the same level of cases coming in? Or is it because they actually have a better level of leadership in terms of being able to manage the office? I thought that was very interesting that this would come back with specific areas that actually say that they have enough time to actually adequately do their caseloads as well as the resources. So
the resources really include what's happening in the community. What resources are there in the community? And I will tell you, from the sub-cabinet for workforce and education work that I did, we were trying to figure out a pilot area, and it was almost hands down the Lafayette area has the most resources, and in that sense it's not so much doors to knock on as it is also how included the economic development arm is into stabilizing households and getting people in. So it's a regional approach to a lot of the things that we're talking about, right? It's workforce development. It's, how do we make sure that would-be employees are getting trained and wrapped around. So it's more than that, but it is also about the leadership that is stable in the Lafayette office. And that's important. And there's...
So when you say stable, do you mean in terms of length of time? So you're talking about people who are more experienced?
Yes,
or?
ma'am.
Okay.
Yes, ma'am. And so I do think that, we can figure out chicken and an egg issue, right? Are they stable because it's a better office because they're stable? I think it is both. And I think that over time, we've learned from some of the things. We've allowed Lafayette, as a matter of fact, when we first opened up our eyes to understanding how a closed loop referral process might actually benefit our work with 2-in-1, we went to child welfare in Lafayette to look at that and learn from it. And so what we're hoping is what we have learned will extrapolate well to what we're building, for example, in Baton Rouge. Also note, though, that the partnerships are different everywhere, right? Every community is a little bit different. And I believe that we might find some other information from what they have for us. But so far, that's what we know. And what we know about, we're going to do better with. And the more we know, the more we will the more we'll do with it. I will say that before this survey was sent for, about 8 months ago, we had contracted with LSU School of Leadership and Human Resource Development. I've been studying that school now for about 18 months. I came across a couple of professors who were doing some incredible work, and we had them come in and do a turnover intention study for the managers to determine if a manager leaves, said the executive staff to me, that's an even bigger hit than any place because they're leaving with all of the institutional knowledge. So we got preliminary reports that almost mimic what we got from the legislative auditor about, I love doing this job, but I feel like I can't do it well. I need more resources and some other things. And so what we're finding here, these partnerships, that pillar that we put in about partnerships, that's real. My Community Cares, we have some incredible data that we can show about how that's really working for prevention. But it also, when we gathered together with Casey about 3 weeks ago on a Wednesday for an all day, we had all the statewide leadership in child welfare in one room. And what they wanted to tell me was, if I have resources that I can actually send parents to, if I have resources that will actually see this child, sometimes they're just not in that community. And it takes, so that's when the poverty of our state or the rural nature of some of us where we live, we have trouble with transportation to get where we need to get to. Those who are willing to step up and be foster parents, for example, they're willing to do the parenting, but they don't have a lot of resources, but they're also working too. And so if a child needs to be seen in the middle of the day, then that causes for workers to have to go and take them, right? And so it's complicated by those factors. I think that we can do an assessment to determine what makes these other ones actually stable and then utilize that. Right now, we know what we know, but we can know more. And studies and assessments work, and I believe with our university partnerships will really yield a great opportunity to come back and say, Senator, we figured out more of what makes it better over there, and we want to extrapolate that over.
I would love to see that. And then lastly, on my question on the survey is, who was actually surveyed? Was it just the child welfare workers, any supervisors, any managers?
Yeah, everybody.
So
Everybody
everybody under that umbrella.
everybody up to, state office.
Okay. Okay, because one of the things that have come back to me is the level of retaliation. And so I don't know how many folks feel really at ease in sending that information by email, even though I heard you say that it's being redacted. And so none of that information would be shared with the level of leadership at all.
Correct.
In terms of comments, the things that were shared.
And that's one thing that we feel like for any project that we do a survey on, it's really
Okay.
important that we maintain that anonymous feature. So we're going through those text responses one by one, and if they say, name a supervisor, by name, or anything that might give leadership a sense of who said what, we'll take that out.
Do y'all
just to
have a
protect-
breakdown like caseworker, manager, supervisor? I'm just wondering.
Yeah, actually, in some of the charts, Julie, you might be able to point to a few. We break down the responses based on the level of, so like on page 17, Exhibit 10, we broke down the responses on the question whether they feel that people are held accountable. And so obviously the staff felt agreed the most that was happening, and as it got further up the chain, they felt that they weren't
Okay,
held as
gotcha.
accountable. So there's several places where we broke it down because obviously from the level that they're in, they're going to have a different experience and a different viewpoint. So.
Okay. All right. Thank you. Thank you, Mr. Chairman.
Thank you very much. Senator Boudreaux, the floor is yours.
Yeah, thank you, Mr. Chairman. And as it relates to the audit, I just also want to Mr. Wagasback and to the team that it's I think the secretary said it's not a got you moment. I sense and I feel, as I said in my opening statements, that we're in this together, and you all have done your part in providing that information. What I like, Mr. Chair, is just to follow up on Senator Barrow's questions in the lines of transportation. Staff is going to have to help us. We have a joint budget meeting every month. And so when we talk about, fixing things, to wait a year to provide additional transportation is when the state, for the last 6 years, we've had a surplus. So somebody's going to have to help us navigate that. But when we talk about low-hanging fruit, and I would hope we can get the assistance, Mr. Wagasback, from your team in identifying that cost. I don't know, but it's mind-boggling to continue to sit and hear. We probably got rid of some 1960 Chevrolets and, got a 2000 Chevrolet that was, on auction somewhere, and we're in 2022. But if we can come up with that figure, and I'll also ask, as you all, continue with your work in this area, if there's anything else, let's get it to leadership, and let's find out what we can fix today. Because, Madam Secretary, your presentation was spot on. I mean, your preparation was quite evident that your team is focused on correcting some inequities. And I just want to find out again from the legislative orders to this perspective, what can we do now? I mean, and let's not wait. Let's not continue to have another meeting and we're talking about somebody's got to use their own vehicle, or we just don't have enough. When we talk about morale, that's what leads to these type issues. So, Mr. Chair, if we can, not for today, but continue that dialogue and find out what can we bring the joint budget. I mean, we meet every month. I think everything goes to joint budget today. This is important. That's what needs to go to joint budget. Okay, so that's on that from the transportation standpoint. And Senator Barrow, if I could just chime in, I've had a couple opportunities to sit with our team in the Lafayette area, and I'm proud of the work that they do. What I guess a little over 6 months ago was my probably before that, sometime in the summer. Our initial meeting with the team there, we brought in everybody, and I was just so impressed with our team in the Lafayette area. But when they talked about the experience, they spent 10 years maybe in New Orleans and maybe a couple years in Shreveport, and they landed in Lafayette. Mm-hmm. And I remember the meeting because it was just amazing that they didn't grow up and just stay in that area. So we got a mixture of all of those. One of the things that came out of that meeting was that we feel like sometimes we don't get the assistance from other agencies, and I said that earlier. I know LDH has jumped in, and I know the other agencies, and I had a conversation with the governor and his people, and I said, I met with our people in Lafayette, and I could tell you, they just don't feel like we're all in this together. And he said, well, what is it they're not doing? I said, well, I don't know, but somebody needs to go and find out. And then we had another meeting, I want to say, somebody help me, when was that last one? November maybe, October? And again, we discussed things. So I want to just real quickly Judge DePlanche is one of those Senator Mills that we work with, and you know him real well also. But he's at our meetings. The legal community is just a comprehensive effort, and I want you to know that we still fall short, but I was so impressed with our team and our people in that area and those resources that the Secretary identified earlier. When they go away, we have nothing, and we have parents who are trying to figure out what's going on. The foster care movement is now into the churches, where we have adoption and things going on. So while the report does identify that, I just again want to appeal to the team. I know there's some long days and short nights, and I know sometimes it's a lot of criticism. I think you hit it on the head. Being a supervisor is not a good place to be in when things are not going well, and the challenges that come with it. But I just wanted to again to our team that's here. We've lost a lot of people, and I don't ever want to lose sight of that. But I don't want you to become discouraged or think that we're not listening. And I'll just speak for myself that we have to get you more resources. I talked to the Secretary earlier this week, and I said it didn't break overnight, and we're not going to fix it overnight. But what we can do is we can identify an action plan on what we can do. So I'd like to start, Mr. Chairman, with further discussion at another date on transportation. And Mr. Wagesback, if there's anything else that you feel this agency could benefit from in a timely manner, Senator Barrow and I are both on joint budget. and Senator Mills, by the way. So that's three people on joint budget that we need to take some items to joint budget so that we can show these are some of the things that are tangible and we can take care of like right away. Let's not go through another budget cycle to wait on, 2 more cars or 3 more. I have no idea, but whatever that is, and again to the auditing team, if there's some additional things that you all have identified that maybe can help this agency. This is the agency that's under they're under the light right now, and we have to do some things that'll change that. And these are some of them. So that's where I'm at. Thank you.
Thank you very much, Senator. On that note, kind of as I'm hearing it, I'm watching the Senate attorneys and they're writing it down also. But on that note, we're going to be going over, and to what Senator Boudreau is saying is we have the 7 strategies here. What expanded to either budgetary requests, budgetary needs, efficiencies. Get another section, because this document, I think, will be evolving so much that we can send this to Senate Finance. We can do that type of thing, because I would guess that from where you're at right now, being you're almost 6 months into your fiscal year, and you've done some pay merit raises, you've had some requests, that your budget could be strained to the standpoint. So I think what we should do is we should have Section 8, which would not be basically your timelines, but that Section 8 would be, budget requests, budget stabilization, certain things. So that way, that document can be shared with Senate Finance and the Senate Finance team.
Yes, sir.
So we'll take what Senator Boudreau is saying and we'll expand on that. So, Senator Luna, you've been patient, and as the chairman of Audit Advisory, I know we wait to hear from you.
So the reason they're doing so well is because of my great leadership in Audit Advisory. So congratulations, sir, and you're welcome.
That's what we want.
A couple of questions. First of all, Madam Secretary, thank you for this presentation. It was very well done, and I think that we're making some strides in the right direction, and I appreciate that. I want to ask you some real pointed questions dealing with this issue that we've talked about with transportation. Why don't you have cars assigned for each field worker in your department?
Yep.
Why do you not have them? Why don't you just give them a car?
Yep. So first of all, Eric, the undersecretary, is like dying to be able to say that there are no cars available on the state contract right now based on the lack of car availability. That doesn't really answer the question Senator Luna was asking, which is why have we not gotten to the point where we've increased our budget where we are assigning every CPS worker or field worker that needs a car? That's your question.
That's it.
And so as we have built our budget over time, we have been taking incremental steps to increasing our resources. Some of those incremental steps included incrementally changing out the old cars to the new cars. And
Let me interrupt you a second and ask you this. Do you know of any other state agency that has field workers that work out in the field dealing with people on a daily basis that don't have a car assigned to them that they can use? I mean, what did the police, they have cars assigned to them. Probation and parole. Now, theirs have a couple of 100,000 miles on them, but they have cars assigned to them. What other agency that works in the field on a daily basis does not have cars to work out of? Do you know of any? I don't know of any. I don't know why we don't give you the money to buy automobiles for your people to go out and see these folks that they have to work with. Senator Boudreau is exactly right. It's incredible that we've not addressed that, and we will address that, I assure you. Let me ask you, the auditor, something. How many other performance audits have been done that were similar to this on other agencies? Do you know off the top of your head of any that we've done?
Recently, it's 3 or 4. We've done job satisfaction or agency culture type audits.
Were there any similar findings in those audits?
It's like it was already said, a lot of these issues are similar across all work environments.
And I would think that probably that's something that you would see just on the nature of the beast, if you will, in this instance. Is that right?
Yes, I would agree.
And I think it's important that we look at that and we analyze that, but at the same time, I think it's important that we recognize that this is probably just the nature of what these folks do. We're looking at some of these findings, and a lot of it is tied to too much caseload. Why do we have too much caseload? Because we don't have enough money to hire more people, or because we can't hire other people. By the way, Senator McMath, I'm chairman of labor too, and you're welcome for that low unemployment. I'm sorry y'all have to endure that, though. But the fact of the matter is, some of this is just systemic in the nature of what they do. I don't think that it's necessarily a terrible thing. However, there are some findings in the audit that concern me, and there's some lot of room for improvement. I think you're heading that direction. Please let us know what we can do to help you to get us there sooner.
Thank you, sir.
Thank you.
Senator
Thank you, Mr.
Leno,
Chairman.
if I may, we're currently doing a follow-up audit of EPS, Elderly Protective Services, within GOEA. They were formerly within APS, Adult Protective Services, within LDH, and we have heard similar concerns from their caseworkers about transportation. Either there's no rental cars available, or I think right now they can get reimbursed by state travel policy on their own private vehicle for up to 99 miles a day, and that does not even cover a lot of the driving, especially in the rural areas where they go. So we've heard this from several agencies that deal with.
So I had a person that sent me an email or a text or something, I don't remember. But anyway, they said their agency had a mileage table, and they said if you were going to whatever place, you got X number of miles. And I don't remember if it was a man or a lady, but anyway, they said, but when I got to the city limits, I continued to drive to where I needed to go so I could do my job. I didn't quit driving there, but I didn't get paid for that in my own vehicle. We can do better. We have to do better. If we expect these people to perform at the level that we're insisting they do, we have to give them some simple tools to do their job with. I'll get off my soapbox now.
No,
Mr.
very
Chairman.
good. Thank you for the labor employment issues. We're very happy about
You're welcome.
that. On that note, I think what I've heard from both of our committee members is there is a gap. Let's identify what that gap is, and then do a cost analysis of what it would be, and we'll have it in our report of timelines, and at least that's something we can report to Senate Finance and Joint Budget, and that would be something we can hand off to them. Any other questions? Oh, Senator Pope, I'm sorry.
I know you always forget me, but that's okay.
No, never.
I won't hold that against you. Thank you, Mr. Chairman.
Never, Senator.
Before I ask my question, I want to compliment you on your report, Madam Secretary. I think it was probably very informative. I lost you somewhere along the line because the information was here. My limit is here. But I do appreciate it and certainly thought it was very thorough. As far as the audit, I think y'all are right on target by requesting doing this, whomever. I've not had an opportunity to really dissect it the way that I probably will. But overall, I would applaud y'all the way that you've approached this, because I think it's something that we can look at in order to make improvements. And that's what this committee, and I think that's what around the state we're trying to do, is to improve a department that wants improvement. So I think that's where we are. Now, my question is, in the audit itself, and maybe Madam Secretary, you could address this as well. And I'm looking on page 17 with the exhibit 10, where you got staff, you got supervisors, managers, leadership. I'm wondering why that's the structure the way that it is. How many people do the supervisors have to oversee, or what is that ratio? What is the ratio of managers to, I guess, leadership, and the leadership as to the actual worker? Is that the way it works?
Yes, sir. And that's the way that we have to work with civil service.
What that number is? I asked that for a question that I asked in this committee last time, and I won't, well, I might somewhere along the line bring it back up.
Yes, absolutely. And so
There's silos now. You know where I'm going with that.
yes, sir. And I think, to a certain degree, silos, if you will, are created because you have to form teams of people out to do a certain amount of work. And then there's like the military or other places, you have a line of supervision, right, that people need to follow, a chain of command, if you will. And so depending on the division, there may be 8 people that one supervisor or supervisors. In child welfare, it's a little less than that. I think it's 5. That 5 workers, 1 supervisor. So then a manager, we're talking about the frontline field staff, a manager would have 3, up to 5 supervisors that report to the manager. And so the manager's job is a little different than the supervisor's job, is a little different than the worker's job. I think right now we do have some blurring of the lines because we have so few, right, that people are bleeding down. And one of the things that will allow us balance is when those persons who have those jobs can really just do that job and not have to pick up someone else's job. And so when supervisors really have the ability to just supervise, then we will be able to have a better balance. And what that means is that we need an adequate number of caseworkers to work the number of cases that we have today, not the number of cases it was built on several years ago. And so I think that we are looking at not just the number of cases, but we're also looking at the complicated nature of the cases. And so some of the work that we've done is to bring in certain people with certain specialties to be able to provide consultations to the workers and that supervisor for the type of issue that they're dealing with. This really brings us to a level of needing different types of professionals that really can be experts in an area to provide guidance in a particular area. So that being said,
Those people, how would they be employed?
so we have what we call consultants. That's literally
Okay, I'm with you.
the job title for the consultant. A consultant might find themselves doing different things. For example, a consultant is the actual job title that we're using for the case assigner. We talk about it as a case assigner, but the actual position title is a consultant. And so a consultant is someone who's shown themselves to become an expert through the system over time. A consultant, depending on what we're looking for, doesn't have to be someone that was born in child welfare, so to speak, and rose through the ranks. It may be a person who is an expert at something specific that we may need.
So in summation, and I'll go on because I know the chairman's going to fuss at me for taking so much time, but that's okay. I guess to sum this thing up for me is the fact that there's got to be some kind of level somewhere, but it could be 8-1, 5-1. There's no set number on that, and it probably could go to even regions of the state. I don't know that. I'm guessing.
Correct.
I don't know anything about your business.
That's right.
But, so it has to be that flexibility. Well, one of the questions that I'm getting from John Q. Public out there is, we got this high level of people up here, they're not doing any work. I'm doing all the work down here. These, for the lack of a better term, quote, peons, unquote, we're doing the work, but all the high-level people getting all the money, all the pay, and all this kind of stuff. I just wanted to put that out and say that maybe that's not accurate either.
Yes, sir. And I would love to be able to address that for every person who works at the department. Every job is super important, and not one is more important than the other one. They're all equally important.
Every one of them's got to be important.
Yes, sir. But
matter.
some of our field workers don't really understand what happens at the state office level to have to deal with the federal grants, the federal requirements, the research and the reports that need to be done, et cetera, right? And so there are definitely different skill sets, different job needs, and different types of employees needed, all the different levels. I will say that after assessing here, now I'm an attorney, but I'm also a graduate student in human resource development.
I won't hold that against you.
Thank you. So my assessment, though, throughout all this time is that there's no position that we have that's not needed.
I agree. I'm not
Right.
here to question that. I just wanted out for the record to understand that there has to be some flexibility in the way the staffing goes.
Thank you, Senator
You
Pope.
answered my question.
Yep.
My question is back to the auditors now. I think you had answered the chairman a while ago about other audits that are done for other, maybe Senator Luno asked the question. Other audits done for different agencies. Are y'all finding the same thing, that there's no ratio or there's no balance in the ratio, or
You mean the same results as
8-1,
far as
2-1,
morale
5-1,
or?
6-1?
Oh, as far as supervisors
Yes.
to, I don't know if we've looked at that specifically
Okay.
across the board.
Okay.
That's something that
That's fair.
civil service looks at.
That's fair. That's fair.
And is sort of a requirement, so to speak,
I
a
understand.
supervisor or
Okay.
manager.
Thank you, Mr. Chairman.
you very much. The board is clear from the legislative audit standpoint. Mr. Wagaspack, your team, y'all do a fabulous job. We want to thank you. And I can tell y'all from all of our vantage point, we use these audits sometimes to introduce legislation, to work on things like that. So thank y'all so much for the work that y'all do. We really appreciate you. So on that note, why don't we start going through the 7 strategies, unless anybody else has any other issues? And because we're starting to get familiar with it, and each strategy has certain results, can you tell me what's the symbolism in the red versus the print? What does the red indicate? Because I see what you're saying scheduled, I see completed, and I see end of state support, but what does the red versus the black font mean?
Sir, thank you so much. We want to exactly help you understand that. I've asked Amanda Brunson to join us at the table. She's been sort of quarterbacking this work to make sure that it is readable. And I know that when you first look at it, you're like, what the world? But there's an answer to that. And I've asked Amanda to drive us through that, because she drives us every Tuesday and Thursday along with the deputy secretaries to understand where we are today and the work that we did over the last couple of days. Amanda?
Thank you, Secretary Ricks, and good morning, Chairman Mills and members of the committee. My name is Amanda Brunson. I serve as a Special Projects Officer in Child Welfare. And as Secretary Ricks said, I do kind of drive the incident command updates, and part of that is serving as coordinator of the 7 strategies in the timeline. So to help you kind of get grounded in this document, as Senator Pope said, there's a huge volume of initiatives, tasks, everything that we're working on. So it is a living document, and as you heard from Secretary Rick's opening remarks, there are even things that we're doing that are not necessarily reflected here. And so we've tried to put this in a format that hopefully is digestible, but we welcome your feedback if there's something that we could do differently. The items in red are ones who have had a change since we last met at the end of October. So there's this other handout here, the stabilization timeline updates, where we've tried to specify exactly what those changes were. Many of them were a date change, and in a lot of cases, we actually accomplished something earlier than we expected to. And then I think there's one that there was a wording change. So
Did we all
we'll
get a
check
copy?
in
Did we get a copy of that stabilization one? Okay.
the smaller document.
Okay. Could I get a copy? I don't have one. Me and the vice chair don't have one. Maybe we don't need one. You're right. Thank you very much.
So this is kind of a cheat sheet of just the things that are in red. So if it's in red, it's reflected on the smaller document as well.
So I guess if you were sitting on the police jury, that's a change order. You changed your timeline?
Yes.
Okay.
Right.
And the most important part of this to me is the explanation on the
Okay.
right side. That'll help you understand, why is it in red? This is the thing that is in red, and this is why it
Okay.
was changed.
So just to back up, when we had the very first one, this is modifications amending the document.
Yeah.
Correct.
Okay,
I
okay.
think the very first time we gave you the timeline was October. So everything that has changed since that original document is now reflected here, so that you can hopefully keep track of it with us.
Okay. Very good. And so is there any, so we'll get started, and I think we're all getting to the point we're getting familiar with it. So like, let's just pick on this one item. So let's talk on 1A, attract staff, recruitment activities. You have timelines, you're hitting those timelines. You've given us detailed information of your results from there. So I don't think from the last meeting, we don't have to spend as much time on it. So what I guess I'm saying is, for the committee's working document, and staff also, if you want, when we get to 1A, we'll kind of look at it. If there's something we need to note on it, either as a committee or as your department, we'll brush over it if it's not anything really a big discussion item. If it's a big discussion item, then let's get deeper into it. And Madam Secretary, between you and your team, if you see we get to a section and you say, this one's tough, let me kind of tell you where we're facing, why don't we make it that type of
Very good.
discussion? So I guess the last point I guess I would make is, you might have had some timelines that you moved, and that's in red.
Yes.
Okay, very
Correct.
good, very
Right.
good.
Yes. So everything that's moved is in red, and then if you refer to the smaller document, it tells you how it moved, if it moved up, if it moved back, and the reason for the move. And if it's helpful, Chairman Mills, we talked about last time maybe looking at November, December specifically, so we can
Correct.
kind of talk about what's current, what's in our smallest set of priorities, or I guess sprint list.
That's
So
what I was
if you would
thinking,
like me
too.
to walk through those, I
If we could
can.
walk through, to me, the most immediate things. Now, if you see something long-term that you want to just bring out, now would be the time to bring it out. But I think if we concentrate on just this small medium-term issue, we can go with that.
Certainly. Well,
So why don't we run through it as quickly as we can, but open up for discussion.
Absolutely. Okay, so 1A, as we've talked about, those are mostly our hiring fair events. And as you'll see, we've done several of those, and we did push a couple of the dates. Those are the ones that were in red or ones that were delayed a little bit. However, we did also add an event in the Baton Rouge region.
It's important to note that one of the reasons why we moved them is because we had 300 people to process in HR. I want to say that when we first started this, we were thinking it would be really great if we could get 50.
Yeah.
So we're over 300. So
You can just handle so much volume.
that's right. Thank you.
Okay. And if I see no questions on the board, just keep going. And the minute I see a question from the committee members, I'll stop it right away.
Thank you.
Sure. And 1B, which is about attracting staff through public outreach and advertising, you'll see that we've accomplished a lot of things as far as the social media and media campaigns related to the hiring fairs. The piece of the work that we're doing right now is soliciting for communication services for not only this, but also recruitment of foster caregivers and kind of an awareness campaign on the prevention services side of things. Like Secretary Rick said earlier, when do you really call 211 for a family to get support versus reporting abuse and neglect? So we have been soliciting for those services, and now we are in the process of contract development for that. 1C is hiring process improvement and simplification. Simply stated, we've just continued to use our streamlined processes for that.
And it looks like you hit all your goals on the timeline on that.
We have, and I guess I'll back up and just say if there's a black star, it means it's completed. If it's a dark green box, it means that it is a scheduled item. And if it's light green, it's kind of like it's just continuing into that future space.
So the unsung heroes of the Human Resources Department, I want to sing for them today, okay?
Yes.
Here's to HR and all the partners that are helping us with that. Thank you.
And not to belabor the point, but this helps as it's a working document that check it off the box. You did it. So congratulations.
Thank you, sir.
1E is university outreach. So this is about being able to get people into our agency earlier and have them begin their training, begin understanding the work of the organization when they are still in school. So this is a new program. We've brought on someone to help us manage this. And as you can see, we've been recruiting students to participate in the program. The pilot actually begins next semester.
We're also doing it with student input. So our first STAR participant is actually graduating from Southern University on Friday, and then she will be able to join us directly from an internship position to a professional.
So I'm going to flip the page on pay incentives, which is 1F. There is nothing on the schedule for just that quick, November, December. I know, is there anything else that you want to add there?
No, I mean, we're continuing to work with civil service on all the pay things, and I think his letter was very helpful.
It was.
And then today we actually had some premium pay approved for the attorneys. We have been losing attorneys. They've been running out the door to other agencies and other jobs. But today, while we've been here, civil service took an action for us to help us with that.
And on that note, what Senator Boudreaux talked about and Senator Luno, as far as the automobiles, to me, there's going to be some budgetary challenges. Maybe on that new section, you could note that because we were able to do this and it's helped us, here's where we could have some budget issues.
Yes, sir. And just so you know, we're working consistently with the division on that as well. And so the undersecretary is capturing all those things. We'll be able to have those conversations with you as you would like, as we're having with the commissioner's office.
But this will help us for a handoff document.
Absolutely.
Thank you.
1G, hiring planner and caseload forecasting model. This is something that we put in place back in the earlier fall, and it's updated every month. H is evening and weekend coverage. So this is when we've talked about 24/7 availability of people to go out, particularly in the Baton Rouge and New Orleans areas. We have worked with a couple of agencies and narrowed that down, or in the process of finalizing a contract to be able to begin that work.
We do have a question, and let's just jump in, members. Senator Vera?
So this is something that I believe that we talked about in the Select Committee on Women and Children in terms of having where people can actually stop, and then you still have individuals who will be, how would they be kind of labeled or titled?
Yes, ma'am. Thank you. So honestly, you could look at them as if they're DCFS workers, like
Okay.
they're contract workers. So they will
Okay.
be doing some of the same work that our workers would be doing if they were working overnight, and sometimes they do now.
Okay.
So this is only a Baton Rouge area contract at this time. We're going to see how this works. I think it's going to be
Okay.
more expensive than if we had our own staff. So if we can stabilize in the daytime hours, we can continue to ramp up employees, our own employees at some
That will
point
work
to take
nighttime.
over just the night shift.
Okay.
But because we don't have enough to take care of the regular
Gotcha.
8-hour day, at this point, we're going to augment
So it's
with this
like a
staff.
pilot,
Yes.
kind of like a pilot right now?
Yes, ma'am. Or a short-term
Okay.
solution, a bridge solution, until we can get to a place where we can do more. I don't believe that the cost-benefit analysis would show that we need to do this statewide.
Gotcha.
I believe this is a bridge until we understand how it works well. The best thing about doing something first in one area is that you get to learn from it. So we're working with the Blanco Center to do assessments on this. How well does it work? How well does it not work? We also have the ability to see, is this handoff working the way that we think it will? Again, what looks good on paper, what sounds good, may not actually work well. So we'll have to learn and tweak the way, through the process. The contract will allow us to do that in Baton Rouge. That determines, do we need to expand the contract someplace else, to New Orleans if we're in a spot, or have we learned enough and we're stabilized enough with our regular group of employees that we can add a night shift of DCFS employees as opposed to using the contract. So this is something that we'll be watching with
Okay.
you to see how well does it work.
And when does it start again?
So the contract's like almost signed, but we have actually started training a few of their people already, even though the contract's not quite signed yet, so that we can begin to use them as soon as the contract gets signed. So we kind of thought it was done, and then we got a few remarks back from the contractor. So
And
we're
how
working through
long
those
is it
now.
for? Is it
Is it
6
3
months, a year, 3?
1-year contract
1 year contract?
with opportunities to go beyond.
Okay. Okay. Thank you.
Thank you very much. Keep on, please.
1I is the Employee Assistance Program, which you've heard is up and running in our pilot areas, Lake Charles, Lafayette, and Baton Rouge. 1J is the inclusion and belonging work, and so we do have someone on staff now who is also helping to kind of lead the space, plus we have the work of our DEIB council. And so this reflects their kind of exploration process right now, where they're figuring out exactly what the employee-led priorities will be. 1K I'm going to skip, and L I will skip because there were not fall deliverables there. So M is Foster Care Support Organization. That is some work that we do through contracts where we have people around the state who continuously support our foster caregivers. N is our Foster Caregiver Advisory Board, and they meet every other month. So you see that they met in November and will meet again in January. O, our recruitment activities for foster care. We do have a statewide recruiter now on staff who is working with each region to develop the specialized, strategized recruitment plans. And so that work is just wrapping, and then they'll begin implementation after the first of the year.
What would you say is that person's goal
To increase the number of foster caregivers, but also to help make sure that we have the right types of homes in each region. You know, are we really struggling with homes for teenagers or with infants or with children with special health needs? And so helping to sit down at the regional level, understand where our issues really are, and then be able to help recruit with those things in mind. And that person also is participating in our foster caregiver advisory board.
Okay.
And so they're hearing from our foster caregivers and their networks really what the needs are and how we can better recruit and support foster caregivers.
Thank you.
1P, again, is public outreach and communication. So we've largely covered that when we talked about it earlier as far as the staff recruitment piece with the communications campaign. And then Q is faith-based and other initiatives. We did pilot kind of a fast-track training recently, and then we've just begun working with a national expert who's helping us look at some other aspects of our home development program. So moving on to number 2, which is multidisciplinary response with key partners. We've talked a lot about law enforcement and the importance of our partnerships there. So we are in the process, Evelyn and Mona both have been traveling around the state with our regions, meeting with law enforcement and making sure that we've looked at our partnership agreements and that we're updating those as necessary. You also heard about 2B, which is the child protection model that we are piloting in East Baton Rouge. So we are just within the last couple of days now co-located at the Family Justice Center. And the next kind of phase of this work that we're in right now is solidifying those charter agreements with the partners. Skipping down to 2D, which is about the policy related to reports from medical providers. We did make that change a while back, and we just have a check-in point here in December to make sure that it's still meeting our needs and that if there are any adjustments needed, we can do those. 2E is enhancing our partnership with CASAs and CACs. So the CACs have been involved in those regional law enforcement meetings that have been happening in November and December, and additional meetings with regional level CASA offices will happen a little bit down the road.
And before we flip the page, explain to us the Texas model one more time. That I see there's some delays from just the interaction of Texas. Just briefly.
There's a couple of things. One, just being able to get over there while we're doing everything else, we've actually determined this is one of those things that we just cannot pull off right
Understood.
now. That's one thing, but even in our conversations with law enforcement, they're not so sure that this is the best model too. So we're using this to talk with them about whether or not this is something that we go. But remember, it was about having somebody that has that background with us all the time. So we
Yes.
might be checking that box by our partnerships. We haven't taken it off the table, but it's not really something that we can go to Texas right now.
Okay. Okay. Very good.
Right, and that child protection model is really kind of closely intertwined with that, and we'll learn a lot of lessons there.
Yeah.
Okay.
3A is about early childhood supports and services, and so we've been involved in kind of the restart of that, and that group is going to start meeting pretty regularly around now. B is, again, going back to that communications firm that we'll be working with. Again, this is the piece that's more about the supporting versus reporting prevention services awareness type piece. So we have continued to have our nurses on the ground in East Baton Rouge. That pilot will continue for the next couple of months. 3D is Child First, and this is a pilot. We started to work with the parent organization in the summer. I think we finalized that agreement, and so they've been helping to look at our pilot areas and who we can partner with and vet those affiliates and things like that. So we're in that space of working on a couple of contracts with those pilot sites, and then training and things like that will happen before service delivery begins.
And as a reminder, Child First and Intercept are prevention. How can we not take these kids into custody? What can we do for those families?
Right.
Very important.
And so in line with that is Intercept, which is 3E, and we are in the process of beginning the work in EBR with that program. 3F is Family Service of Greater Baton Rouge. Again, this is an opportunity for us to work with a community partner to do some in-home services, some of the work that normally our workers would do. And so it took us a little bit of time to figure out how to do that work differently and make sure that we were checking all the boxes and had thought through everything. So we've just wrapped up the contract and are beginning implementation on that one.
As you expand programs and you move into new regions, is it creating a budgetary issue for you, or it was budgeted in this fiscal cycle?
Well, so, one thing about our budget is that there's some leniency in it because depending on what you do, depends on which buckets of money you pull from. So what we're doing right now is we're trying to hold all of these things in abeyance to see, is it going to cause a problem or not, or does it actually take up a space that we're not using money someplace else, so we're using it for this.
Okay.
Right, so that's the assessment that the Undersecretary is working with programs on to make sure that we can be, forthright about that in our conversations with the division and you guys. Right now, until we start utilizing services, your utilization amount is actually going to be what actually matters. So forecasting is hard when you have a new program. So I would say we would be able to bring that back to you.
Okay, and that kind of is in the light of what Senator Boudreaux was asking
Yes.
earlier. Okay, as I see expand, it's like it's great for this committee. I just didn't know if it was causing pressure points from somewhere else. Why don't I turn it over to Senator Barrow? Senator Barrow?
Yes, well, I can go on from here. And these are some of the things that we have talked about. And so one of the things I have said that I was going to do in every meeting, which I failed to do in the very, very beginning of this meeting because of how it started, was acknowledge at least the 2 babies that died from my district. But there are at least 4 that I mentioned here, because you told me about one other baby that I need to mention. That's Mitchell Robinson III, Jahari Paul, Ezekiel Harry, and Christian Baptiste, which is the newest baby that I just learned about. And I do that because I know that we have had a lot of missteps, but those missteps have caused lives. And I know that we are on the right track of trying to get this right. And I appreciate everything that you've said, but I will do this because I will always remember how we got here, why we're here, and how we're trying to avoid this ever happening again. And I know that's your goal at the end of the day. That's the goal of this department, for making sure that this doesn't happen again. But one of the things that you and I talked about was when there are multiple calls that have come to the agency, and on some of these families had multiple calls to DCFS about some level of complaint. As we're looking at prioritizing high-risk infants and toddlers, because all of these were under 2 and under. I know that there are some things that you guys have put in place, but I am really concerned not only for the 2-year-old, but for children who can't really communicate what's happening to them. How are we trying to address that issue? And part of this is not Louisiana's issue, because this is a issue of the country in terms of trying to maintain that we keep families together. And I'm not about breaking up families, but I want to make sure that we are evaluating whether or not keeping a child in the home is the best place for the child, and how are those assessments being made, especially when you've had multiple calls to a household. What are you able to do, or what needs to change so it can give you more latitude to do?
Yes, thank you so much. And of course, if we accept a report, right, that's the first, coming in the door, we use risk assessments. A risk assessment will take into account other cases that we've had in that household and or other calls that have been made. If we accept the case, which is where we were talking about, a child that's under 3 is going to go very high on the risk assessment tool because they are nonverbal. Right? So the risk assessment tool was changed in 2020, along with the work that we've been doing with our partners at Administration for Children and Families, the federal government, and our other partners, like the Pelican Center, for example. And so working with professionals and partners, we changed our assessment tool back in 2020. That's what we were using. So in the cases of a couple of the babies that you spoke about, it wasn't that we didn't accept necessarily. What we all were up in arms about is, dang it, we didn't get there on time, right? And so getting there on time is about what we've been talking about today. Got to stabilize the caseloads, got to get more people out there, and I got to know if we did or we didn't, right? And so that part we need to that's where our efforts are right now, to make sure we have enough people to make it there on time. So we are talking about a couple of things. When a call comes in, what do we do with it? How do we assess the risk, whether we accept? Some of the changes that we made in policy were to accept. Now that also means that we have more cases coming in to do investigations on, which is why we're making all these efforts to augment staff until we can get it stabilized. So if you have a more specific question about what happens next, I have asked Mona Michelli, who is the Deputy Assistant Secretary, who's over some part of the effort, to come up and be able to explain the risk assessment, then how they get assigned a particular statement of, we need to go out by a certain amount of time. Getting people out on time is what all my efforts are on right now. Right now, we're also working with Casey Family Programs to reassess whether or not that assessment tool is still good today, given what we're given, even though it was just a couple of years ago that we created it. We think that we might have to look at the door being so wide for so many coming in for investigation. That's hard to say when we think, man, maybe we need to do more investigations, but we also have to balance how wide the door is and how many souls we actually do have to go out and do investigations. So we make sure that those who are at higher risk are getting the services that we need.
So I don't know if Mona can speak to this or not, and because I don't want to get too far into any of those investigations. But this was actually implemented in 2020. So 2 of those cases, I know 3 maybe, have happened since that time. And I know, according to what I read, let me put it that way, according to what I read, several calls have been made, and you said we didn't get there soon enough. I don't know if they were associated to what actually led to the death or not, but again, I don't want to get to the in-depths of what happens, but if this was introduced in 2020 and we still had where we had the death occurred, but there were calls that were made, then we didn't get that soon enough. But what could we have done differently if there were problems that were being outlined or being signaled to us?
So, Senator, I want to, because I don't want to get as deep as you want to get on the process, but what I want to say is that we have done an assessment on every case to determine, is there anything that we could do to tighten up, to lower the risk of this happening? And everything that we're talking about is to get to the point of closing the risk as much as we can for that ever happen again. Some of them are about, did the worker who took the call understand what something was so that they can put it right on the risk assessment?
So you're talking about to the call center? To the call center.
So what we have to look at this, we have to look at each case, we have to look at it from the first time somebody talked to us or sent in a report, all the way to the day that something happened. And along the way, we see a tweak here, a tweak here, a tweak here. Something that needs to be addressed, we need to address it. So that's our job. And I will say to you that there are some incredibly trained men and women who are really committed to being able to do this assessment. What happened in this case, make a determination, and then determine what needs to happen to address it. And there is a litany of things that could happen to address it, from training all the way to firing someone, right? And it all depends on an assessment of, was this a system issue? Was this a training issue? Is there malintent involved? Or is there somebody being lazy? Did somebody not do what they were supposed to do? Did somebody try to do what they were supposed to do? They acted in a way that they believe was right, and we can see they needed another piece of training. So every case, and not speaking about any that you brought up, everyone is important. All our actions, we want to become a place where we can be able to show an evidence of, this is what we did, this is what we're supposed to do, and coming out of it, this is what we found needed to be tweaked.
Okay, so let me go back to my initial question then. When you receive multiple calls on any family, are they on a list? Is there something that's created that kind of like it's a red flag, or something that allows them to receive some additional services, because we know something is happening with this family if we're continuing to get calls. And then secondly, going back to what you just said and what y'all said earlier in terms of 211, 211 would only be a bridge of just being able to connect people. They won't be taking in any information. They'll just be, okay, this is the number you need to call. If you have you want to call in, you have a report, you call 188 whatever. That's all they're doing.
They can take information if the person wants to give information. As a matter of fact, someone who is in distress could actually call 211 and talk about their distress and even say, like, it's really helpful for me. And 211 will actually call them back at another time to check on them. So depends on what they're calling about or what the need is. But what we were talking about in this particular case is a lot of times people are calling because they see a child who seems hungry, or they see a child who seems to not have had a bath in a while, and they're concerned about that. So when they call and talk to the 211 person, they can help them to determine, oh, is that what you see? You know, we have resources for that, but this might be something that you need to call DCFS, and then they can give them the number at that time. So one of the things that we've been talking about with Casey Family Programs, for example, is what is an appropriate diversion? If you're calling, even if you get us, and then what we realize is that this is really doesn't rise to abuse and neglect, what can we do? And there's some legal conversations about, can we do that if they're calling us, right? Can we send them to someplace else? Or how do we do that? So we're having rich conversations to figure out how can we mimic what's going on around the world, showing itself to work, to divert people to resources, community resources that can actually help in this case. One thing that I know for sure that we have is if we've been involved in a family in the past, there's a case. We know that the centralized intake will be using that to determine the risk associated with this call. Mona, did you want to
No,
say
that's
more?
exactly right. So whenever a call comes in, the intake worker has access to all of the history and pulls that information in to assist with decision making, and also to pass that information on to the investigator to consider in their assessment. That we have also, or right now, are implementing what's called an agency history training to go back and train staff as well, the importance and what to look for in that agency history to better inform the decisions as well.
So even though we have the dilapidated system, it still can show you that information, and you guys are able to kind of see if there's history.
So there's
with that
actually
family.
multiple systems. So that's
Yeah.
what the training really comes in, that you have to access another system to
wow.
make that. We have been having some conversations with a potential provider that could basically use maybe AI, artificial intelligence, to mine that a little bit more quickly. Those conversations haven't advanced too far yet because it takes people to do that. But this is what we talked about. I'll never forget Amanda telling me one day, we were doing some work, and she's only been with us for about a year, but she's a foster mother. And she was telling me, like, hey, we were doing some stuff, and I was like, hey, can you check this for me? And they pulled up a green screen to look up something. And that's actually happened. It's still happening today.
See, those types of things right there to me seem to be kind of basic, and we should be able to, and I know we're kind of working through it right now with some of the contracts, but it's still, to me, it's causing that backlog and a little time delay with some of the information that you need to be able to make quicker decisions.
Yes, and OTS is really doing their best with us right now. So we actually have a meeting tomorrow with them to pick up some low-hanging fruit. These are some of them. We put some of them on the list to see if we might be able to use. So we have one system that's actually not outdated. It just was for one piece. And so the conversations we've been having lately is, can we take that more recently updated portion and add to it? some of those things are in the old legacies. So we're
So-
having those ongoing conversations.
So with that system, every worker knows how to access it. They can go in, or is that something that people still have to be trained on?
People still have to be trained, and not every worker will be doing that. Some of it will be done at the centralized intake area, right? And so we talked about some of the long-term work that we need to do, meaning definitely longer term than March, and taking a look at the entire table of organization like Senator Pope has brought up. What else do we need? Sometimes I get afraid that the state, that the front level staff would be like, I can't believe you're adding another person into into the state office. And so what we need to do, and this is what we will do, is we'll involve the states, the staff, the field staff in the conversations about what we need to do to actually right size the organization. Under Governor Blanco, I was the undersecretary for this department. At that time, I can tell you, in child welfare, we had a policy unit, a budget unit, an HR unit. All that was removed over time. So a lot of the things that happen here now have to go through the Undersecretary's Office of Management and Finance, which was also downsized. So all of these little things that take a little bit more time, they contribute to the larger issues.
Thank you. I think that's almost going to really complete my questions. I would just say that, we did not get here overnight, and this is a humongous issue, and being able to have to sit on both sides and go through the process, I understand completely a lot more than I did a few months ago. However, I do want us to really begin to reconsider how we look at children when they come into the system or when they come before us. When a call is made, I don't think that it needs to be an automatic that the child needs to stay with the family. And when kids are too small to really communicate that, and they can't tell you, sometimes we are leaving them in a worse predicament than getting them out. And so I know that's kind of like probably going against the grain of many folks, and probably 6 months ago I would not have said that. But as much as I have begun to learn and actually experience, then I know that this is not always the best option. And so I don't know what that looks like. I shared an idea with the governor that I have not shared with you.
Okay.
That will cost some more money, but we need to have other options, and making sure that there's a communication system that everybody or the people who are receiving the information can access if a family's in crisis. I think that's really, really important.
Thank you, Senator Barrett. See, your partnership, and I know that you go to NCL and everybody else looking for
Yes.
more and more
Yes.
education. That's great. We want to keep walking that with you. And even if the idea is a little bit different than somebody else, I think when we get the best ideas is when we get to the table and we push a little bit.
That's
and there's a
right.
little bit of friction from different viewpoints. For different goals within the bigger goal, right? Different objectives within the bigger goal, and we get to where we need to. And so we welcome your idea. I can't wait to hear about it, and your input is valuable. So we'll continue to work with you on that.
Well, thank you. Thank you, Mr. Chairman. I appreciate it.
Thank you very much, Madam Vice Chair. We'll keep going. On that same note, you said you have green screens. You talking about the green screen monitor?
Mona?
No, you don't have to get to it.
I'll just say it looked like the old DOS system.
Okay, so because
Like
sometimes
the
a green
black
screen
with
is
the
something you
white
use for
green,
video.
you know.
That's where, okay,
Yeah,
I
no,
just was.
Yes,
so have
you're
y'all,
right, like a DOS.
yeah.
prompt.
So have y'all done a
It's a
needs
DOS.
assessment on your technology of what it's going to
Of course
take?
we have. Like the senator said, we started a project. We ran into some issues. We're working with OTS about that. And I promised OTS what I would say if this came up is, please talk to OTS about that.
Okay, put it in section 8, please, please. Okay, thank y'all. Please continue, Amanda.
Sure. So we are on number 3G, which is improving oversight of high-risk in-home cases. And this is really about starting to look at data around in-home, court-ordered in-home safety plans. And then we will be meeting with some local legal partners in January to discuss that. The next one, H, is My Community Cares. You've heard about that. That was began as a pilot a couple of years ago, and now it is going statewide through our family resource centers. 3I, we will skip over because there's not anything happening in this quarter. The same goes for 4A, B, and C.
So one thing
Let's
that I'll
talk-
say about A, B, and C, the coordinator with the managed care, is this work we're doing directly with Secretary Phillips and their team. We've been doing some really good work of looking at the communication mapping. What do we know? Who knows what and how? And even more so, I saw an incredible list of services that are available through the MCOs that we may not completely understand in the department. So
Okay.
we're working on with that, and Secretary Phillips promised multiple meetings as needed to take one issue at a time and pull it all the way through. I think we have great partners there.
Yeah, and I think that timeline needs to probably be, because I think if you look at 4A, key tasks, select managed care organizations to serve foster children, and the discussions, that may needs to be modified, because I know from the discussions we've had, and I've talked to the secretary, is to understand what is the contractual obligation of LDH that can also pass on to you. And I did get calls from the managed care organization saying, we want to work together. So I'm glad. So we're not looking at this moment in time for any kind of new contracts or any kind of new services to
No,
be
sir.
developed. Okay.
But I will say that the first key task under A was really about the foster care leadership, looking at all the different providers to determine, did we want to work with all of them for foster care, or did we want to identify several of them to work with the foster care population because of the services that they felt they were stronger in?
Okay.
Doesn't mean that all of them don't provide it, but some of them are stronger and actually have proven proven themselves to work better in that case. So that's what the first one is.
But from our last meeting, it's much more understanding with the two
Much more
departments.
understanding. Thank you.
From our Senate attorneys, I know you had helped us last time. Any comments? Okay, thank you very much. All right.
Thank you,
I'll
Ms.
also just add that there is a lot of work happening that's not reflected in a point on the map. You know, the flags here, like a green due date, is really when we expect to have something kind of wrapped and at a point. So there's definitely a lot of work happening
Okay, very good.
outside of that. So moving on to 5A, which is validation and modification of policies. We've had some internal and external reviews of policy. The next phase of that is a review of our home development policies, which relates to the training and certification of foster caregivers. I'm going to skip B because there aren't deliverables there. C is the safety wraparound approach, and that work has began a couple of months ago with some case consultation at key intervals, and that work is continuing.
I will say that of all the work in Baton Rouge with the new regional administrator there, we are going to make sure that we're hearing from her. Is it too much to implement all at one time? Do we need to put something, prioritize one thing and then bring the next thing on after that? So I appreciate the way that the committee is looking at everything as a living document. So it might just be overload. Change management overload is difficult, requires a lot of communication, but also make sure if the management doesn't understand it and can't get their hands around it, then we're going to be in trouble.
From a management standpoint, have y'all done an assessment of basically your top management that is of retirement capabilities? Have y'all done a succession on that?
Yes, sir. We do have that information, and
Is it pretty scary?
it's very scary.
That's most industries right now.
Yes,
It's pretty
sir.
scary. You keep people so eligible for retirement.
Yes, sir. But we've had, I didn't mention, there's a lot that we haven't mentioned, but one of our Lean Six Sigma projects was about succession management. And we had our first class and our second class of Lean Six Sigma professionals. So we believe that we're going to have more and more projects that will allow us not only to see, but also figure out what can we do about it. And this one of them that's in our target right now.
Very good. Thank you.
5D, we brought in a national expert earlier in the summer, so he's continuing to participate in case reviews and case planning meetings and things, particularly in Baton Rouge. 5E is the Policy Academy that we've recently joined with the Department of Health, where we're really centered on substance abuse in child welfare and particularly work around substance-exposed newborns. So that academy runs through April. And it's not just LDH at the table. There's some other key partners who are doing that work with us.
But it will inform the work that we're doing with LDH on the MCOs. So even if it's just about raising our own competencies and understanding, which will be more than that, but that's an important part.
Very good.
And on the last page, we don't have anything in the November, December categories. So we're happy to talk about anything that you'd like.
No, the board is clear. And I guess the question we'd all ask, and I know it's, and you don't have to get into detail, but of all the things that you have right now, what's keeping you up at night the most? If you had to prioritize from your vantage point, from your new position to knowing that you have such a responsibility, what would you say the key things, Madam Secretary?
Number one is the timely assessment of the children that come in through the intake. And that is what drives everything else on here, actually. All of the retention and recruitment work is to drive being able to have timely assessments. And we talk a lot about CPS, but I have to tell you, every other aspect in child welfare is just as important. And we're keeping an eye on those too. So the number of cases in family services, the number of cases in foster care, the adoption, right? So I just want to say that we've been talking a lot about this. Timely assessment is super important. Timeliness is important to us in all aspects of the work.
Very good. Madam Vice Chair?
Yes, I feel like we are wrapping up. And so I wanted to first definitely thank you for the overview. It was very thorough. And you kind of glanced over it, but I just want to kind of go back to the fact of some of the things that have happened that are positive, that many of us were unaware of or not really paying attention to because it kind of got overshadowed by the things that were not positive. The amount of money going through the kinship care program to really help and aid families, because this is really a way to really begin to address poverty. Because at the crux of all of this, I believe, is hopelessness, poverty for sure, and education. When you start looking at all of the factors, all of this is all interwoven together. Mm-hmm. And so that to me is, something that you did talk about in the very beginning. And I just wanted to reemphasize that because that is a positive. It hasn't happened in how many years? I mean, how long has it been since we had an increase?
The last time we increased by that? 20 years. More than 20 years.
More than 20 years when the cost of everything is going up. So that's extremely important. And I just wanted to go back and re-highlight that because we have not highlighted that enough. And that means a lot to many families. And one of it is per child, right? Is the kinship care per child the increase? Am I right?
Shavonda, did you want to come up?
You could just hit that real quickly.
Thank you, Mona.
Good afternoon, Shavonda Howard, Assistant Secretary for DCFS on Family Support. So the kinship care increase was up to $450 per child that's in the home.
Yeah, that's what I thought. So I mean that's significant, especially for grandparents who are raising grandchildren, which numbers keep jumping. I know we're in the top 5 percentile. That makes a huge difference. So I just wanted to make sure we re-emphasize that again because that is important and it makes a big difference.
Yeah, and part of the importance of that too is that it really gets it almost to the very near what a foster care person would get. So it means that I really can take care of my kin, right, without going through the foster care system, without going through DCFS for that reason. You just apply for the kinship subsidy. You don't have to go through, right? And so I think it's important that we keep shedding light on the different ways that we can help without a child coming into care.
And that's a very good point that you bring up. I think that, if a family member sees another family member in trouble, and, before it has been very burdensome to some families to try to bring on and have to take care of another person, another child, this is definitely another tool that can help them without it being so cumbersome, a lot of work, and just a little frustrating sometimes to even get done. So I just wanted to bring it back up and highlight it because we kind of glanced over it today, but it was definitely worth noting and making sure that people are aware of it. And those positive things that we are doing, we need to make sure that it is getting out there because sometimes we don't communicate it well enough. Yeah.
So much communication.
Yeah, it is.
Thank you
so much in communication.
So much communication.
Thank you. And once again, on behalf of the committee, we do have someone that would like to testify. Everybody else was for informational purposes. Last name is Carly. You represent Louisiana families with individual disabilities. So you did ask to testify, and your opportunity is right now, ma'am. And while we're doing that, and you coming up, just so the committee will know, we'll have a brief discussion with the Board of Medical Examiners. And I did want to, on behalf of the committee, thank all the DCFS team, everybody from the caseworkers to management to everybody else, because when we first started this, I think the morale was really in a tough situation. We wanted everyone to know that this is a working meeting to make sure we can all work together to make things better for the children of Louisiana and the families. So we want to thank all of the workers at DCFS on behalf of all of us here. Ma'am, the floor is yours.
Good afternoon. My name is Karonda Corley. I am a proud parent and national disabilities advocate for individuals with disabilities. And I am pleasured to be in front of you today to speak on behalf of our individuals with disabilities and their families. As it relates right now, I want to bring up some things that I've noticed that was provided in the documentation that actually give me a pause. Number 1A, you held a job fair in the Baton Rouge area virtually. Are you aware that there are some areas in East Baton Rouge Parish that do not have access to internet? I know our state of Louisiana is more than 80% rural, so you have a lot of areas that do not have access to internet. So how exactly are you holding a job fair for individuals to actually come to a department that says that they need more employees, but they don't have access to the internet to actually be able to apply for that job? That is a problem, and that is something that we need to look at. In addition to that, they actually have on here many things that are contradicting, that are saying that the tasks are completed, but then it also says that it's scheduled. So I just want to know, is it completed or is it actually scheduled? Because that's a contradiction. If it's actually scheduled and it has been completed, then it needs to be stated that it was scheduled, it was completed, and that we're not rescheduling it again. If it is something that is going to be a rolling item that is going to be continuous, then we just all had to put that it was continuous. But the way that it is worded right here in the document that is allowed for the public to review, it is a contradiction.
And Ms. Carley, if it's okay with you and the committee, we making this kind of a dialogue where we can go back and forth. And as you mentioned those issues, the secretariat asked her to address it. And when we do have suggestions, they're putting it on their to-do list. So I'd like to make this more of a dialogue than a testimony, if possible. So hold your thought. And on the virtual and the issue with your ongoing, Madam Secretary, maybe you could reply to Ms. Corley's concerns.
Absolutely, and thank you so much for bringing that up. I want to say that our Director of Diversity, Equity, and Inclusion and Belonging is here and can talk about the steps that we are taking to become more inclusive. And so that means from access from all different ways. I would like, if you'd like for her to come up, she can come up. Her name is Dr. Jessica Jones. On the job fair that we added, we had multiple people that had already applied for a job. So by using the virtual job fair, we were able to get those people in that day and then set up. So it was a modified fair. We've had one in Baton Rouge already, and the next one is on December 15th in person. So we've been using every effort that we can to communicate to those, so anybody who wants to come in person has an opportunity. And then the last thing I'll say is that the hiring fairs are not exclusive. In other words, a person can apply the normal ways as well. They don't have to come to the hiring fairs to be considered. So we will take all the ideas that you have, though, to make everything that we're doing. That was the only one that we did that way, to kind of capture and be able to immediately interview the people that had applied in other ways.
And I'll add on, Dr. Jessica Jones, Director for Diversity, Equity, Inclusion, and Belonging. And so For the hiring fair, for the virtual one as well as our others, we were prepared to provide accommodations for individuals who would actually identify. They would self-identify upon check-in, and we were prepared to provide the accommodations. But we definitely are open as we continue to redefine access at the agency. We're definitely open to partnering with you and the organization that you represent so that we can increase access at a fuller extent. So we really appreciate you bringing that up.
So it's all yours, Ms. Corley. I just wanted, as they were talking, and I wanted them to be able to respond to you.
Yes, sir. Thank you so much. Also, I did not notice anything that talked about the children with disabilities. Or the individuals with disabilities. As you know, right now in our state of Louisiana, we have a large number of children with disabilities that have actually been reported to DCFS. Our families are always targets. The school systems use it as a form of retaliation. So if a family like myself, I'm gonna use myself as an example, my child was abused in the school system, and if I report the abuse to DCFS, they will not investigate it. This is an unspoken policy that is held at DCFS that nobody ever brings to the table and that I would like to bring up to the forefront. There are many families, including in St. Tammany Parish, Ascension Parish, and other parishes in our state where the families have reported to DCFS their children being abused in the school arena, but DCFS never investigated. So the families then have to actually go to the police department, and due to the police department being third-party contracted with the school systems, they do not really do a thorough investigation, and so that put another task on the family. So the family then has to go to the state police department, which we do know now is currently under investigation by the federal government. So I do think that that is another thing that we do need to look at, the unspoken policies that are actually that are there at DCFS that have not been brought to the forefront, that is not actually written for anybody to review, to actually take into consideration, that is impacting our families negatively in this state. And I would definitely allow them the opportunity to respond to that.
Yeah, and I guess if for time purposes, this is very important and we'll set some ground rules, but if the discussion needs to get more granular, y'all can always visit after if that's okay. Because I know you want to put it on record, but if the discussions get really lengthy and y'all have to go back and forth, I may cut it short for y'all to visit after the meeting, if that's okay with everybody.
Thank you, Senator Mills. I'll just ask our Chief Deputy Assistant Secretary to just talk about our what we're charged to do regarding schools.
Exactly. Department of Children and Family Services investigate.
State your name just for the record.
I'm sorry, Evelyn Jenkins.
Thank you, Ms. Jenkins.
The Department of Children and Family Services is charged with investigating cases involving families. So that would be parents, caretakers of that nature. We do not investigate schools.
Right, and that goes back to, the law, the children's code, and those kinds of things. Though they're really not unspoken, though. This is a part of what is a part of our rules, and we can talk a little bit more about the right processes and those kinds of things. But the bottom line is that schools are not defined as caretakers, so it goes through a different process.
And so what I would respond to you on that is, actually they are. There is a law that actually states in Louisiana that the teachers, because they are with the children 8 hours a day, they are considered as the caregiver and as a parent in that capacity of that time frame. So they actually legally can be investigated. It's just a choice by DCFS to not investigate them. And that is a problem, because they definitely would take out the time to investigate me if the school system stated that I was abusing my child. But if the staff is abusing my child in that school arena, I can report them and they would not do anything. And it is imperative that we actually look at that staff in the school arena are considered mandated reporters. That is another law here in Louisiana that we also fail to actually acknowledge. So if they're acknowledged as mandated reporters, parents should be acknowledged as mandated reporters too, to be able to report when their children are being abused in an arena, even though that is an arena that is governed by our Louisiana Department of Education, who always state that they have no legal means to mandate and report or also enforce. That is a problem, because you are now leaving family and children who are very vulnerable to continue to be abused in an arena that is receiving federal and state funding. So that is a problem, and that's why I'm telling you it is an unspoken policy, because as they just stated, they do not do it because it's an entity, but Louisiana law state that those reporters or those employees of the school arena are considered the parents, so they legally should be investigated as well. Definitely the contracts as it relate to contracting nurses. There is a state and national shortage of medical personnel, including nursing. So I don't see how we're going to actually fulfill that. And I would love for them to come back to the table and tell us how that is going to be fulfilled. And last but definitely not least, we always talk about wanting to model things after states. And so they talked about wanting to model stuff from Texas. Texas is not in the top 5, nor are they in the top 10. The top 5 is Massachusetts, New Hampshire, Minnesota, Utah, Vermont, New Jersey, Connecticut, Nebraska. So why are we modeling something after a state that's not in the top 10? We did that when it came to education, which was an epic fail, and we're going to do it for the Department of Child and Family Services, which will hurt more individuals. If we want to look at countries that are in the top 5, then you would look at Iceland, Sweden, Finland, and the Netherlands. I do think that we have to make sure that we remember that the children that we are talking about that are deceased, that brought this, that made this, actually have to come to the light. They were reported by mandated reporters, hospital staff, and our Department of Child and Family Services did absolutely nothing. And so I think that it is problematic when we say, hey, we are working on something. Every time we talk about that they are working on something, it still leaves cracks where more children fall through it and they die. And so I don't want to see any more children or individuals with disabilities that are dead and having to be buried because we are still working on something. And that is the problem, and that is something that we need to bring to the light. We had a very nice packet that had nothing to do with children with disabilities, and that is an extreme problem, and that is something that definitely needs to be addressed, because they are verbal, they are not verbal, some of them cannot communicate in a typical manner, and that is a problem, just like Senator Barrow stated.
You know, thank you so much for your testimony. It was extremely insightful, and I guess I'll kind of speak for the secretary right now. At the very beginning of her presentation, as we were all getting to know her better in her role, she basically called on all groups to work together, all citizens to work together to make this work. So I think y'all have all got a chance to maybe meet each other a little bit better. Maybe y'all could share some contact information. There's a lot of people from the department here that I know that you've given some good information. I saw them taking notes. So I think your testimony was well absorbed by everyone. And thank you for being here.
Thank you so much, Senator Mills and the Senate Committee. And I also would like to say that there is another unspoken policy that I do think y'all need to look at, which is the policy as it relates to the individuals that are now receiving medical marijuana and CBD. Those families are being investigated, although legally you can have CBD or medical marijuana. CBD can be purchased at Walmart, and I have families right now that have been threatened by staff from DCFS to take their children from them, and these are families of children with disabilities. And if you need to, I can contact you with their attorneys. Thank you.
And any information that sheds light is always welcome.
Yep.
Thank you all very much.